I've been involved with this organisation in a variety of ways for about a year now. I was asked early on about how I felt about moving in to work in this space of violence against women and their children, and I talked about 30 years' experience in the community sector and in child and family work, and as a carer of young people, and I said I thought all of that equipped me pretty well, and the reality is that it's overwhelming. The reality of Angie's story is repeated thousands and in different forms of violence and control and intimidation is the experience of millions of women in this country. And there is much hope and there is a fantastic opportunity before us, but I just find Angie's story and the courage with which she gave it so profoundly challenging. As we gather this afternoon, I want to acknowledge and pay my respects to the traditional owners of the land in which we gather, the Dja Dja Wurrung Nation. I want to pay my respects to their elders, both past and present, and to any other elders who are here with us today. It is a privilege to be at this conference with so many people who are committed to making a difference in Victoria, in this region, in these communities. I want to congratulate Women's Health, Lon and Mally, on the courage and energy to put on such a gathering, and congratulate you on your success in some 300 people signing up and being involved. I want to acknowledge everyone in this room and the part that you play in ending violence against women and their children. You have worked long and hard to keep women and their children safe from violence. Some of you work directly in response and support victim survivors, and others are advocating for greater funding and public attention to address this critical issue. So often you are unsung heroes in our nation, and without your efforts, how much worse would the circumstance be? I want to share a little bit about what we understand the mandate and responsibility of our organisation, how we understand our strategy will play out over the next few years, and I want to underscore the importance and the wisdom behind the theme of this conference. You know violence against women and their children by many names and in many forms. Family and domestic violence, intimate partner violence, sexual assault, harassment, dating violence, unwanted kissing, sexual touching, rape, threats against children and femicide. No matter what it's called or how it is understood, men's violence against women and their children remains a daily reality and lived experience for too many. It results not only in trauma and tragedy, but its consequences are like a ripple in the pond, and they play out across communities and across generations. But most fundamentally, it is a breach of the most basic human right to live in safety. And you weren't blind. I think you said as a young woman you were blind to certain things. You weren't blind, and we failed you, as we fail so many women, because we weren't able to support and enforce that most basic of rights. 1 in 3 Australian women have experienced physical violence. 1 in 5 have experienced sexual violence since the age of 15. 1 in 6 have experienced violence from a current or former partner. This means that in our ordinary everyday lives, outside of our professional settings, we all know at least one of these women. These women will be with us everywhere where we gather, and the men who perpetrate such violence will probably be there as well. When we meet at the supermarket, when we gather in a faith community, when we engage at a sporting club or a community celebration, it is not something that is remote from our personal lives, even if it is present in our professional lives. It is something that must be with us and is with us all the time. And because it is so widespread, the prevention of it is not the responsibility of any one group, any one sector, any one level of government. But to achieve real and lasting change in this country, we have to make it everyone's business, everybody's business. The good news is that there is increasing evidence that violence can be prevented. The World Health Organisation stated, and it's on the slide, that violence against women and their children can indeed be eliminated and is not an intractable social problem or an inevitable part of the human condition, but it is a product of complex yet modifiable social and environmental factors. And I'll say that again, modifiable social and environmental factors. So there is a solid and growing international evidence on the underlying causes of violence against women and their children. These causes are attitudes, beliefs and behaviours, practices and systems that promote, justify or excuse or condone it. UN Women in particular, and our organisation similarly, and many in this room, will assert the need to improve gender equality to decrease the prevalence of intimate partner and sexual violence against women. The international evidence is summarised in this slide. Studies across four different gender indexes show that in countries where there is greater gender equality, the prevalence of violence against women tends to be lower. We can modify social and environmental conditions so that we can work towards greater gender equality or gender equality, and one of the results will be a reduction in the incidence of violence against women. Australia has a choice. We can benchmark ourselves against the UK, against the US and Germany, and we can say, look, we're about on our par in terms of the incidence of violence against women. The rates are somewhere in the mid to high 20s for those nations in terms of lifetime experience of physical and sexual violence. Or we can look to Switzerland and we can say, why is their rate a half to a third of those countries? So the point is, Australia can choose a future where women live free from violence if we are prepared to name and to work at the underlying causes. To do so requires a conscious and critical reflection and a sustained conversation about gender relationships, power, and what builds change in culture. And this is precisely where Our Watch, I'll use two names during the course of the afternoon, Foundation to Prevent Violence Against Women and Their Children, the legal name of the organisation, and Our Watch, the initiative that we launched in Sydney in early September. But this is where Our Watch comes in. This is where Hannah and Teresa and Emily and I are involved, and with a small but growing team, we hope to be able to work over time to the underlying causes of violence against women and their children. We hope to be able to work to change the attitudes, beliefs and distorted values that cause the circumstance that we're talking about today. We exist because of a vision of the Commonwealth Government and the Victorian Government, one that's been joined in by the South Australian and Northern Territory governments. They own and have created our organisation, and they've licensed us to go to places that perhaps governments are sometimes believe need to happen, but are uncomfortable or unable to go to. But we are also here because many in this room and the women's movement over 40 years and White Ribbon and others have said violence against women must stop. So what you have effectively done is put the prevention on the national policy agenda. And you have accordingly tasked Our Watch with reducing the rates of violence against women and their children through a primary prevention approach. So what is primary prevention? It is about challenging the deeply ingrained attitudes, beliefs and distorted values that give rise to men's violence against women and their children. It involves engaging formal and informal settings that in some way reinforce, allow or ignore these attitudes. The formal settings are those of work, of public life, of school and of organised recreation. The informal are those of community, neighbourhood, the family and the interpersonal. And the media spans and powerfully informs both the formal and the informal. The attitudes that primary prevention aims to challenge are ones that support gender inequality, sexism, and those that perpetuate myths about rape and domestic violence, and myths that somehow it's a woman's fault for getting herself in these situations. And yes, these attitudes still exist today. Every woman in the room will know them better than I know them. Every woman experiences them and lives them through their daily life. But we would have hoped that attitudes would have shifted in a positive trend over the last few years. But the powerful message is that they've got worse. Vic Health recently released the 2013 National Community Attitude Survey, the third NCAS, a survey of 17,500 Australians. And they reveal that a significant proportion of Australians still excuse, trivialise or justify violence against women. A growing number of Australians think that a victim is at least partially to blame for incidents of domestic and sexual violence. Almost half believe that rape results from men not being able to control their need for sex. And 1 in 6 think that women say no to sex when they really mean yes. These are the core attitudes that drive behaviours, that give permission and licence across a population group and across a culture to allow something as abhorrent as we're discussing today to continue. The results are similarly poor regarding gender equality. 1 in 4 Australians think men make better political leaders. 1 in 5 believe that men should take control in relationships and be the head of the household. The report clearly reinforces that to prevent violence against women, negative attitudes around gender equity need to be addressed. Given the energy of the last decade in this area, and given the commitment over 40 years by so many women and networks and groups, I would have hoped the best for the results for the younger generation in the NCAS data. But the data is again confronting. People aged 16 to 24 have a lower level of understanding of violence against women and are more likely to excuse it. They are more likely to endorse relationships where men exert power over women. And even though young people are more supportive of equality in some areas, say with regard to education, they are also more likely to endorse men dominating decision-making in relationships. So if we thought we were making ground, we're not. As hard as we've worked, we have to work harder. And so it's really critical that as a new organisation emerging on a scene where so many have worked hard at a community, a regional, a state, a national level, if not international level, for so long, we took some time to carefully think about our model of change, our theory of change, and our priorities. We've set out in our strategy, and at the afternoon tea there'll be not sufficient copies for everyone in the room, but a pack containing our strategic plan, our theory of change, and some other information. And all of that material is available online at our website. But we've set out within our model 4 work areas that are interrelated and that we believe that over time can affect change within the Australian condition. The first is to lead a sustained and constructive public conversation. And why? Not because the goal is for our organisation to be well known, but because this conversation creates a strong authorising environment for the work that we all do, whether prevention, early intervention or response. And because it enables innumerable small everyday life conversations that are the key to changing both attitudes and behaviours and the key to affecting long-term change in community and in culture. We've tried to start on that journey by creating some form of national institutional endorsement for our organisation and for our work. And we're delighted that the Governor-General and the previous Governor-General have joined us as Patron-in-Chief and Patron. We're delighted also that we're expressed or named in the second action plan sitting under the National Plan to Reduce Violence Against Women and Their Children as having responsibility within the prevention space. We've also tried to recruit a team of passionate and knowledgeable public spokespersons that can reach across the breadth of the Australian community and act, as it were, as our ambassadors. So the Sex Discrimination Commissioner, Elizabeth Broderick, Karja Blah, Miranda Tapsell, Stella Young, Charlie Pickering, Damien Walsh-Howling and Lieutenant General David Morrison are the first of a limited number of ambassadors who will share with our Chair, Natasha Stott-Despoja, the responsibility of public engagement. We will also work with the media to improve reporting of violence against women and their children. Unlike many other complex social problems, violence against women and their children is not an issue that necessarily requires a raised profile in the media. It has almost daily coverage. But what is often missing from the media coverage, and certainly missing from public discourse, is an informed analysis and understanding of the links between sexism, gender inequality, community attitudes, and the violence that women experience from men. And in the worst case scenario, some reporting or commentary actually perpetrates or excuses precisely the kinds of attitudes and myths that give rise to violence in the first place. One of our first projects is a national media engagement project. It is designed to attend to these issues. Currently, the community appetite to understand and to prevent violence provides a unique opportunity to strengthen and inform media commentary. And the media have, as I've said, a powerful role to play in helping shape public attitudes and perceptions, both in formal and informal settings, and to help us attend to the attitudes that inform the perpetration of violence. We're not saying that it's the media's fault, and we're not saying that the media is responsible for these views. There are multiple forces at play, but the media does have a powerful influence across formal and informal settings. So the activities that would form part of the program include training of practising and future journalists, the development of a national media framework to guide the sectors in consistent engagement with the media across the country, a website portal of resources for journalists, a high-level media advisory group influential upon the program of our organisation and influential within the media at editorial and academia levels. We're also keen to develop a national victim survivors media advocacy program, building on good work that's been done in several programs across the country. And we similarly want to develop hopefully next year, a national award scheme to recognise and encourage accurate reporting of violence against women and their children. And this work is possible because of the great work in Victoria of DV-Vic and their partners in the development of the pioneering EVA's Ending Violence Against Women's Awards. We hope that a more informed and helpful media commentary will assist our Watch and all the organisations in this room to create a common community-wide message of respect and non-violence that will eventually become social knowledge shared by all. So since we were launched last year, or announced last year, and since we launched the initiative at the beginning of September, we have tried to, through that year, develop credibility that enables us to fully enter into this large public conversation. The first was in part the address by our Chair, Natasha Stott-Despoja, to the National Press Club in November of last year, and more recently her comments at the national launch of the Second Action Plan at the Australian Parliament. We hope these first large forays onto the public stage positioned us well, but the launch in Sydney gave us another opportunity, a chance to launch a device that is more broadly accessible, a statement of how we understand our task, of how we understand the issue and the particular approach that we want to bring as an organisation and the approach that we can all play. And as part of that event, we released this brief video. Apology to those in the room who've seen it, but I'd like to share it with you now. Thank you.
I want to be a pilot. When I grow up, I want to be a scientist. I want to be an artist. When I grow up, I want to be an architect. Police, lawyer, astrophysicist, firefighter. I want to be a nurse. And I want to be a pilot or something. When I grow up, I want to be a nun. When I grow up, my husband tells me what to do. When I grow up, my wife puts me first. I won't be seen or heard.
When I grow up, I want to tell her who to be friends with.
I'll beat my wife when she offends me. When I grow up, I'm going to end up in hospital because my husband hit me.
This is the dream of No Child Ever.
1 in 6 Australian women have experienced physical or sexual violence from a current or former partner.
1 in 5 Australian women has experienced sexual violence.
That means each of us knows one of these women.
I know one of these women. Me.
No child enters this world dreaming of committing violence.
No man wakes up one morning and out of the blue murders his partner.
The long road to family violence starts with the belief that women are possessions, not equals.
Most men are not violent, but the vast majority of acts of domestic and sexual violence are perpetrated by men against women.
Our beliefs about the way boys and girls, women and men are supposed to act are formed in childhood.
Around the world, gender stereotypes and unequal power between men and women are the most important underlying causes of family violence.
We can stop this before it starts.
By saying no to attitudes, stereotypes and behaviours that support gender inequality and violence.
We can help boys create more positive and healthier ways of being men.
We've come a long way since the 70s. Violence against women is on the national political agenda, and there's great work going on in our communities.
But still, 1 woman is killed nearly every week by a male partner or ex-partner.
The murder of children usually occurs in the context of family violence.
Extreme violence often occurs when the woman tries to leave the relationship.
And those who don't leave live with countless acts of violence every day.
This can't happen. Not on our watch.
Not on our watch.
Not on our watch.
Our watch will challenge the attitudes, behaviours, social norms and practices that underpin and create violence against women and their children.
We will engage the community, educate, raise public awareness.
And keep violence against women and their children on the national agenda.
Until life is better for all.
You can help us.
It's the responsibility of all of us.
Challenge stereotypes.
Call out sexist attitudes.
Speak out if you hear excuses for violence or victim blaming.
Spread the word that violence is never an option or a solution.
And there is no excuse.
Acknowledge respect and equality when you see it.
Celebrate our role models.
It's up to you.
It's up to me.
It's up to us.
Because we can create this world.
When I grow up, I want to be proud of who I am.
I want to be friends with everybody.
When I grow up, I want to change the world. When I grow up, I want to be me. I want to be me. I want to be me. I want to be a superhero. When I grow up, I want everyone to be happy. We deserve to be equal. When I grow up, I want to be safe. I want to be safe. When I grow up, I want to be safe.
Together we can work to end violence against women and children.
It is time to stand up, to speak out, to take action on our watch.
It's time to act on our watch.
We hoped when we released that video that a few thousand people across the country might look at it and our work might effectively start. I talked about 5,000 and then someone said, oh, what if we got 10? But the great news was yesterday we hit 127,000 views. So the first work area is that sustaining that public conversation, a constructive conversation. It gives power and authorises the work that we want to bring to effect in communities, the work that you do every day. It needs to be accompanied by innovative programs that educate individuals and communities and empower them and enable them to engage in the change they need, change in schools, in workplaces and other settings. I spoke before about the NCAS findings, particularly for young people's attitudes. We have to become competent in the social media space. Perhaps many of you in the room are. I'm not, but our organisation must. Marie Crabb's presentation earlier on the role of pornography and its influence on the worldview and attitudes of young people. The portrayal of women in games that are played on the internet and through social media and through game stations and the like has to be challenged, has to be balanced out. It's not sufficient to say young people form their values amongst their peer group and at school and from their family. The most powerful peer group for young people today is an online community. It can be such a force for good. It is such a powerful medium, but it has a downside. And frankly, we are not nearly competent enough in that space. So we're delighted that the federal government has asked us to take responsibility for the Line, the national social media platform to engage young people, and to take that campaign to the next phase as a national social marketing and behaviour change communication strategy, and to look at changing attitudes and behaviours that contribute to violence. We also need to develop, and there are many in this room who are involved in these spaces already, but tailored interventions that can have positive impacts around attitudes about gender equality. Schools are a classic setting. I was delighted to hear the reference to kindergarten earlier in Angie's presentation. There's a lot of focus on work in secondary schools, and in our strategy you'll see we refer to Safe Dates, a US program. And we use that example. We provided 3 case studies within our strategic plan, a Victorian one, another one from elsewhere in Australia, and an international. The importance of including Safe Dates is that it includes a longitudinal evaluation program that has proven its effectiveness over time. And we know that after 4 years of implementation, participants reported 56 to 92% less physical and serious physical or sexual dating violence or victimisation. That rate greater, or a reduction of that extent compared to students who did not participate in the program. And we're delighted that the Victorian Government has invited us to develop and test their new curriculum resources in 3 Victorian school clusters. The curriculum known as Respectful Relationships, Stepping Out Against Gender-Based Violence, was released earlier this year by our Education and Early Childhood Department. And the project will take place in up to 30 secondary schools in the outer eastern suburbs of Melbourne, the outer western metro area, and here in central Victoria. In this program, we will not only seek to develop awareness and embed a culture of respectful relationships amongst students, teachers, school councils, but the wider community connected to a school. We'll try and build that around and using the new curriculum resources as the vehicle. Community-level partnerships are key to this strategy. Partnerships between local governments, community-based providers, and the wider community around schools. And those partnerships will be brokered and supported where they don't exist for existing secondary schools. But let me say, in the longer term, with my own background, I would be really keen to see appropriate programs developed and systematised across the country in primary schools and in early childhood settings. We already have powerful platforms in early childhood in terms of national curriculum and national quality standards that give us the perfect platform for the building of respectful relationships from those earliest years, when we know those deepest sets of values and experiences are built for children. Our third work area is about enabling organisations, networks and communities to effect change. So as an organisation, Our Watch doesn't seek to be the provider of choice of all services across the country. We are not arrogant, nor are we naive enough to think that we can realise what ought to be and must be shared goals on our own. We hope to act as a backbone organisation to a broader movement that you are all a part of. A movement that comprises many organisations, networks and groups to effect change. Core to our strategy and our theory of change is the notion of change being affected by an approach characterised by work that is multi-layered and mutually reinforcing. So that means that at a national level, at a regional level, at a community level, on different slices of community, we will take different approaches, but they need to be complementary. They must draw from similar evidence and they must contribute to a growing body of evidence. And it is only the combined effect, the collective impact of this multi-layered, mutually reinforcing approach that we will affect the depth of change that we need within our society and culture. So the first cab off the rank within this work area is the development of a national primary prevention framework. And we're delighted that this project will be conducted by ourselves as an activity under the Second Action Plan and in partnership with ANROSE and with Vic Health. Vic Health has done some tremendous work within Victoria to develop some 7 years ago a Victorian primary prevention framework. We need to harvest the evidence locally and internationally and to engage in conversation and consultation across the country to develop a national framework that can inform movements from Kalgoorlie to Kingaroy to, give me a K, somewhere in Victoria. Kerrang. Thank you. We also hope, and we want to, in a very respectful way, form careful and considered partnerships that are community-owned and in empowering approaches to our Aboriginal and Torres Strait Island communities and with women with a disability and with our culturally and linguistically diverse communities. Only once we have formed those partnerships and that we are working in a way that empowers and builds for the potential for nationwide programs will we become active ourselves in this space. In Victoria, the Victorian Government announced funding for 2 initiatives with called communities, and we're currently finalising discussions or the process around choosing partners for that work. First with communities focusing on those of Indian cultural heritage, and also we're considering proposals for a new or emerging called community. And we hope within the next month to be able to confirm the outcomes of that process. We're also been invited to work with the Royal Women's Hospital and in their partnership with the Bendigo Health and Bendigo Hospital regarding the potential of health platforms both as an early response site but also as a workplace setting in terms of reducing violence against women and their children. The final or fourth area is influencing public policy systems and institutions. The informal and the formal must always go together. The National Plan is a world-leading initiative. The fact that, notwithstanding political changes across the country, the Second Action Plan was prioritised, consultation took place and has been supported and is backed very strongly, particularly by the Minister assisting the Prime Minister for Women, Senator Michaelia Cash. But all governments in the country are signatories to the National Plan and the Second Action Plan. But all governments in the country also need to change. Change in the sense they need to consider continuously their policy positions, the implications of policy positions, and think broadly across a range of portfolios to ensure that good action in one part of a government platform isn't undermined by less considered action in another part. A great example of institutional intervention was in the Australian Defence Force. It was an example of top-down leadership. So the review into the treatment of women in the Australian Defence Force by Sex Discrimination Commissioner Elizabeth Broderick followed a series of high-profile incidents involving the sexual assault of Defence Force women by their male colleagues. There was an outpouring of anger and disgust, and it triggered a chain of events that led to the beginning of institutional reform. And institutions have embedded within them a powerful resistance to change. But amongst the most potent of tools was the strong leadership shown by the Chief of Army, Lieutenant General David Morrison, who was quick and unequivocal in his condemnation of the abuse within the ranks for which he was responsible. I'm going to share with you now and I'll need again the
Earlier
assistance.
today, I addressed the media and through them the Australian public about ongoing investigations into a group of officers and NCOs whose conduct, if proven, has not only brought the Australian Army into disrepute, but has let down every one of you and all of those whose past service has won the respect of our nation. There are limits to how much I can tell you because the investigations into this network by both the New South Wales Police and the ADF Investigative Service are ongoing. But evidence collected to date has identified a group of men within our ranks who have allegedly produced highly inappropriate material demeaning women and distributed it across the internet and Defence's email networks. If this is true, then the actions of these members are in direct contravention to every value the Australian Army stands for. By now, I assume you know my attitude to this type of conduct. I have stated categorically many times that the Army has to be an inclusive organisation in which every soldier, man and woman, is able to reach their full potential and is encouraged to do so. Those who think that it is okay to behave in a way that demeans or exploits their colleagues have no place in this Army. Our service has been engaged in continuous operations since 1999 and in its longest war ever in Afghanistan. On all operations, female soldiers and officers have proven themselves worthy of the best traditions of the Australian Army. They are vital to us maintaining our capability now and into the future. If that does not suit you, then get out. You may find another employer where your attitude and behaviour is acceptable, but I doubt it. The same goes for those who think that toughness is built on humiliating others. Every one of us is responsible for the culture and reputation of our Army and the environment in which we work. If you become aware of any individual degrading another, then show moral courage and take a stand against it. No one has ever explained to me how the exploitation or degradation of others enhances capability or honours the traditions of the Australian Army. I will be ruthless in ridding the Army of people who cannot live up to its values, and I need every one of you to support me in achieving this. The standard you walk past is the standard you accept. That goes for all of us, but especially those who by their rank have a leadership role. If we are a great national institution, if we care about the legacy left to us by those who have served before us, if we care about the legacy we leave to those who, in turn, will protect and secure Australia, then it is up to us to make a difference. If you're not up to it, find something else to do with your life. There is no place for you amongst this band of brothers and sisters.
We were pretty happy with 127,000 views. This has been seen 1.5 million times. I think, imagine if every CEO in Australia was able to say that to their workforce and wanted to say that, and imagine if 52% of those CEOs were women. It'd be a very different nation. Lieutenant General Morris's action and statements had a global reaction. Anything that we do must be both bottom-up and top-down. The power for effecting change in community and society is both, not either or. The most optimistic thing that I can say to you today is that there is an evidence base that primary prevention works. Australia is already a world leader in public health prevention campaigns, in smoking, in road safety, in skin cancer. We have demonstrated that population-level behaviour change can be effected. Only this week, the results, generational results of the Slip Slop Slap program in terms of sunscreen and the Quit Smoking campaign's data has been publicly discussed again, and it is proven to have changed outcomes. Major reductions in avoidable death, injury and illness have been achieved across each of these programs by dealing with underlying causes and through a powerful mix of legislative reform, appropriate enforcement and evolving social marketing campaigns and tailored and targeted education programs. Programs that had to change over time because some missed their mark, but proper evaluation enabled them to refocus. Our watch will draw on similar strategies as we build our program over the next few years. There is one caveat about the work that we are all engaged in and those other programs, and it is that we are dealing with an issue of power and an imbalance of power. There is power exercised in each of the other domains and campaigns that we spoke about, but it's often power exercised by certain business sectors or those who have a vested interest in certain commodities. The nature of power that we're talking about in human relations, in the organisation and structure of society, pushes much more deeply. And so quick change, as you know in the work that you've done, is challenging to achieve. And so our model of change assumes that we will work over time and into the longer term, and that we cannot achieve it in our own right, that we must work in partnership, that we must collaborate, and that the best role that we can take as an organisation is to act as a catalyst to the next phase of the movement for change and for ending violence against women and their children. We have to dive in deep to the entrenched attitudes, behaviours and practices that surround gender inequity and violence. We have to acknowledge that this is a long-term endeavour and it will require a sustained and at times a program that seems not to hold traction. And we have to work locally and at a whole of a population level. We have to tailor parts of the initiative to critical population segments. And as I've said before, it must be both top-down and bottom-up. And this conference is a great example of bottom-up, of local and regional leadership joining together across service sectors, across local government and different communities to effect change in your own community and region. The hard reality is that it may take many years before we see the measurable shifts that we want to achieve. And accordingly, our strategy sets out both 5- and 20-year outcomes against which we'll hold and evaluate our organisation's performance and hold ourselves accountable. We hope that Australia in 20 years' time will look very different. We hope to see all Australian communities rejecting violence against women and their children and being active in prevention. We hope to see a significant and measurable reduction in the rates of violence against women and their children. We want to see public conversations that overwhelmingly support gender equality and more women and more men being empowered to promote it. We want to see greater numbers of women participating across all levels of all types of organisations. And we want to promote greater sector collaboration working towards prevention. Effectiveness to this issue, effective responses to this issue ought to be understood as a routine action arising in every organisation, in every network and all communities. And we want to see governments at all levels implementing, evaluating and renewing policies, systems and public institutions to promise gender equality and to prevent violence. We want the prevention of violence. We want the right to a safe life and an optimistic and positive life to be a reality for all Australians. Australia can choose a future where women and their children live free from violence. It's up to you, it's up to me, it's up to all of us. Or as we say at this conference, it's everybody's business. Thank you.